Carla with 9 Health, and today we're here at the 9 News Update Desk. We're lucky to be able to have this opportunity, and we're going to be talking about lifestyle medicine with Dr. Michelle Tollefson. Thank you for joining us.
Of course, I'm excited to be here.
Yay, we're going to get right to that. I want to mention that this is our weekly show. We hear every Tuesday at 11 talking about news and health information that you can use to really make informed choices. So it's objective, unbiased information that we hope you can use in your health journey. So last week, if you missed it, we talked to one of your friends,
Yes.
Dr. Jennifer Bolton, and she gave us the 11 foods that we should all be eating. So if you missed that, go ahead and check it out and find out the 11 foods. You can go to 9healthfair.org to find it, or Facebook. So it was so good. And we had all the food on the table, and she told us exactly what to do. And you know, some of it we know, but some of it was a little bit surprising.
That's great.
You know, I actually don't love chia seeds. And so she was telling us a little bit about chia seeds. Okay, I'm looking at my phone just to see if you guys have questions and you want to join us. So please, if you have thoughts and questions, you're welcome to join us, and I'll be looking at my phone. I'm not being rude.
Yeah, no, that's totally fine. Yes.
Dr. Michelle, now I heard your students call you Dr. T.
They do call me Dr. T. Tollefson is kind of a long word, so yeah, Dr. T is how they refer to me in the classroom.
That's very cute. It reminds me of Mr. T. You need to wear some big chains.
Oh dear, yeah.
Okay, well, so, you know, we joke, but you actually are a professor of lifestyle medicine at Metro State University.
Yes.
And you're a physician.
I am.
And so you have kind of this emerging field, and you can share with us a little bit about how this came about and how you became interested in it.
Sure.
So we're gonna ask you a bunch of questions.
Okay, great.
Yeah.
Great.
Yeah. So I guess the very first question, right, is what is lifestyle medicine?
Yeah, so lifestyle medicine is the use of evidence-based modalities to prevent, treat, and sometimes reverse chronic disease, such as healthful eating, physical activity, managing stress, healthy sleep habits, and other non-prescription modalities to prevent, treat, and sometimes reverse chronic lifestyle-related diseases.
So it's kind of the stuff that we know we're supposed to be doing anyway.
Yes.
Except now what you're saying is it can actually be used as medicine.
It can. Well, the evidence is increasing. There's been scientific evidence for years, but lately we've just seen an explosion in the amount of research that is out there as far as healthy lifestyle behaviors and their ability to really address many of the chronic health conditions that we know have a basis or a foundation in our behaviors. And so type 2 diabetes, hypertension, high cholesterol, so many of those conditions are significantly impacted by our daily behaviors. And so it's not that this is something completely new or different, it's just that we have enough evidence now that we're saying it's really important that we emphasize these healthy lifestyle behaviors because they can so dramatically impact so many of our chronic health conditions that many people deal with. We know that United States adults, about half of all U.S. adults have at least one significant chronic medical condition, and
that's a lot of people, right?
It's a lot of people.
That, you know, 50% of us have at least one chronic condition.
Yes, and we know that they can be significantly impacted by some really simple lifestyle changes that can have significant impact.
Right, and you know, not to mention the cost.
Yes.
I don't know if you mentioned that, but you know, 80%. Didn't you tell me 80%? Right, of our spending is really spent on these chronic illnesses that may be preventable.
Yeah, so we know that about 80% of type 2 diabetes, heart disease, and stroke, the World Health Organization says can be prevented by our healthy lifestyle habits, and especially our eating habits. And so we know that if we're able to address these, that we can make a significant impact. Also, about 1/5 of our GDP right now is spent on healthcare, and the predominant draw for our healthcare is these chronic diseases. So if we can change lifestyle habits, we can have a large impact on our spending and on people living healthier lives.
No, that's right.
Yeah.
I think that's a great point to be making. So you mentioned about the evidence. And talk a little bit more about what is the evidence. Can we reverse these chronic diseases and how often?
Yeah,
What's
yeah.
the likelihood?
Yeah, so there's increasing evidence. It depends on many different factors, but the evidence is increasing at a high level. Lifestyle medicine, it's not a fad. It's not a new diet craze or a new fitness gadget that somebody's trying to sell.
That's important.
It is. It is. It's really about those things that we've known for years: healthful eating, eating more plants, eating more fruits and vegetables, whole grains, legumes, getting out and moving more, getting 7 to 8 hours of sleep. And so we have the evidence, and it's in our clinical guidelines. So when we look at the clinical guidelines for hypertension, type 2 diabetes, hyperlipidemia, it recommends lifestyle changes. But so often in our busy healthcare system, physicians don't have a chance to fully educate patients or to help really showcase the importance of those healthy lifestyle changes.
Yeah, I think that's a great point. There's a lot of emphasis on lifestyle, but how come we're not doing more of it?
Yes, yes. So if we look at medical education, so for example, as a physician, we know that in the United States most physicians have about 19 hours of nutrition training during their 4 years of medical school, and very little training usually on physical activity, stress reduction, healthy sleep habits, and the power of meaningful connections and relationships. Mm-hmm. And so this is changing now. We're starting to see the evidence, and training is changing. However, most doctors were trained to diagnose and treat. And so when they go into a patient's room and they have a 10-minute visit, they don't have time to go down all of the behavior change and to really emphasize the importance of lifestyle habits, but they so often
time is really one of the constraints.
Time and training, and also our system of reimbursement. But the exciting thing is things are really starting to change now, where half of all medical schools now have education around lifestyle medicine, and we're seeing physicians just in droves flock towards lifestyle medicine, whether or not they're calling it that, but really trying to emphasize lifestyle as medicine.
So talk a little bit about, you said maybe people aren't calling it lifestyle medicine. What's maybe the difference between lifestyle medicine and functional medicine and some of the other terms? Is it same, different? Tell me about that.
So lifestyle medicine, when I think of lifestyle medicine, I think of it as the evidence-based science behind behavior change and how that impacts disease. And so with lifestyle medicine, it's not anything new. I mean, Hippocrates is credited with saying, "Let food be thy medicine and medicine be thy food." Lifestyle medicine is what our moms taught us: to eat more fruits and vegetables, to get outside and play, to not spend too many hours looking at the screens and the TV, and to have good relationships. And so we've known it for years, but there's really this momentum within healthcare to elevate the focus.
As functional medicine, or is it different?
There are some differences.
Okay.
Functional medicine has some other areas of focus, whereas lifestyle medicine is really looking at the evidence-based guidelines,
Okay.
and public health has really embraced lifestyle medicine too.
So I have a comment here, which is really very great. So
Sure.
Wesley, thank you for sharing this. He says, I agree that lifestyle and eating habits have lowered his numbers in diabetes, cholesterol, and weight.
Yes,
So
yes.
simple counting of carbs, sodium, and cholesterol. So reversing all health numbers and more energetic than ever. Wow, congratulations.
Yes. And that's what we often see too, is when patients start to implement some of these lifestyle changes, they start to notice the changes and they feel different and they want to do more of it. If somebody is trying to follow guidelines and eat a different way just to help their hypertension, often they won't connect that with really wanting to be motivated to continue those changes. But if they're able to connect the changes with how they feel and energy, and having energy to play with their grandkids, and those things are what help people to continue those changes long term.
That's a good motivation.
That's
so we have
wonderful.
Another, Ken says, wow, that really that saved his life. He was given 6 to 10 months to live, so just turned 50. So
it's amazing.
Wow, great job.
It's amazing. Yeah.
So this stuff must really work.
It really works.
But
it really
tell
works.
us how to actually get it done. So you said about motivation.
Yes.
How can you help us with that?
Yes. So it's difficult because we live in a society that doesn't necessarily make it easy for us to eat healthy. I'm a busy mom. I work, I commute, and I know many viewers out there do as well. And so it's much easier for me to swing through a drive-thru and grab something to eat than it is to go home and chop up the fruits and vegetables. And so a lot of these simple things that we know that we should do just become difficult because of our environment. And so
how do we change that?
Yes. Okay. So making I like to think of it as far as SMART goals. So thinking of what
Okay.
you want to do. So you have lifestyle medicine, all the different things. You pick a certain pillar. You pick an
Okay.
area. I want to focus on my physical activity, and then you set SMART goals. So SMART, S stands for specific, M is measurable, A is attainable,
probably heard of
realistic,
SMART
and
goals.
time bound. Yes, yeah,
Right? Because
yeah.
we do this in business, but
Okay.
around your health,
Yes, yes, yes.
give us an example.
Yeah, so if I have a patient and we're talking about her wanting to do her behavior change, we're not going to say, oh, she just wants to exercise
Eat
more.
better.
Yes, I'm going to
Exercise
say,
more.
so what are you going to do? What's specific?
my goal.
Okay, yes,
What
to
I
eat
do
better.
wrong.
Okay, so I would say so what do you want to work on? What food is it?
Well, probably
Fruits,
sugar.
sugar, okay.
I probably need to cut down on sugar.
Okay. So what?
I'm telling one of myself.
Yeah. So where do you think you have the most sugar in your, like in a breakfast? What is it that you want to do?
It wouldn't be breakfast. Where I fall down is at work. When there's sweet treats at about 3 o'clock, I crave it. I've
Yes.
got to have something like a cookie or whatever we have around.
Yeah. So what
and
do you
even
think?
at nighttime.
So
too.
then, I would use some of the behavior change. So lifestyle medicine is very connected with wellness coaching and behavior change. So my guess is that you already know what you might be able to do. Are there certain other snacks or
I know what
foods
I'm
you could bring?
supposed to do.
So you know what you're supposed
But
to
I'm
do.
not doing it.
Yes, and so that's where wellness coaching comes in and says, we help wellness coaches know certain ways of asking about things where they can help people put those things. Because my guess is you know that if you brought some almonds or that you brought a healthy snack, maybe some dried fruit, my guess is it would make it easier for you to be able to make those behavior changes. And then it's putting very specific. So maybe you're going to prepackage your snack and you're going
Okay.
to bring it and have those almonds by your desk. But somebody with some behavior change knowledge or education, wellness coaches, which is part of what our program helps to train, could help you walk through those steps so that you're able to take what you already know and put it into practice and make real significant changes.
Okay.
Yeah.
So it's actually putting what knowledge into practice.
Yes, it is, because most people really know what they're supposed to do. It's just that our environment makes it so difficult for us. So when we take lifestyle medicine, when we take that scientific evidence, break it down into easy steps, and then help connect patients, the general public, with wellness coaches or people who actually know how to help people with behavior change, that's where we're able to see that real transformation.
That's great.
Yeah.
That's great. So
And it is exciting.
it's a great example, and it's really what we can do every day.
It is.
And it's not necessarily you have to go get medicine.
Yes.
If you can stay out of the doctor and do the things that you're supposed to do in your lifestyle every day,
Yes, yeah.
then you can maybe avoid some of those terrible things that happen later on.
Exactly. And what's great about lifestyle medicine is it's not saying not to use medications and surgery and all of
Right.
those things. It's saying let's see it as healthy lifestyle habits as being the foundation of our treatment paradigm or how we look at things. And
Yeah.
so we
Yeah,
can
it's
emphasize
both.
lifestyle.
Both
It
and.
is. It
Both
is.
and.
Yeah. So we don't want you to stop taking your antihypertensive or medication or anything like that. We want you to try to increase healthy lifestyle behaviors and then talk with your provider. Even if they're not calling it lifestyle medicine, go and talk to your healthcare provider about what else can I do? What other evidence or guidelines are out there as far as increasing healthy lifestyle habits that can impact my hypertension, diabetes, all of those different things?
That's great.
Yeah.
That's great. Thank you so much for sharing all this with us. And
course.
we have way more questions to ask you, but we'll save it for another day because
Okay.
there's so many, like you said, pillars of
Yeah,
lifestyle medicine.
there are.
We want to delve into each one
Yes.
and give them their due because maybe people don't realize that things like mindfulness and stress
Yes.
are a pillar that you shared with us, and
Yeah.
sleep even.
Yes.
It's getting a lot of attention now. You have to sleep in order to actually
Definitely.
have a healthy lifestyle. So.
And stress and sleep are intimately connected, and we also know that there's a large tie-in with sleep and stress and with weight, and so very important pillar
We're all
too.
interested. Well, I should speak for myself. We're interested in that way. Thanks.
Yes,
So
yes.
really great. Thank you so much, Doctor, for sharing that
Of
with us
course.
and for being part of this new wave of lifestyle medicine. We will
Yes.
bring more to you about that.
Great.
We come every Tuesday at 11, so join us. Next week we have another really interesting topic right here. We're actually going to be talking about something very, very important, which is vaping. So it's become epidemic, and we want to know the health risks and what we can do about it. So
Very
join
important.
us next Tuesday for that, and we'll talk to you all later. Thank you so much
Great.
for joining us.
Thank you.